If you don't sign up for Medicare when you're 65 years old, well, no, 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 not so fast. Hello, this is Ed Weir, former manager of the Social Security Administration. I help people throughout the country with all things Social Security, Medicare, disability, retirement, survivor benefits. Uh, Check the description below, schedule an appointment. Let's see if I can help you get everything you're eligible for. All right. You are entitled to Medicare when you turn 65 years old, or if you're receiving disability. If you're receiving disability after 24 months, you'll also get Medicare essentially automatically. Right? You can, refuse it if you have other health insurance. Same way when you're 65. So if you're 65 years old and you already have health insurance through work, current work, and your work has 20 or more employees, or your spouse, you can also have it through your spouse's work. Again, it has to be current work, can't be any type of pension, retirement type of health insurance, Obamacare, or anything like that. So it's through current work, 20 employees or more. Don't have to sign up for Part B or Part A. You can sign up for Part A. It's free and another, source of health insurance. Some people do that unless you have a health savings account. If you have a health savings account and you sign up for Part A, then you can no longer contribute to that health savings account. Most Social Security employees don't know that, and they'll say, just go ahead and sign up. It doesn't hurt, but they don't realize that the HSA. So it's Social Security employees are not trained on insurance, Medicare in terms of C and D and all the rest of it, because most of those are, all of those are private companies, and Social Security cannot say anything about private companies like that. They can't make any recommendations. That's against policy and everything. So, not good. All right. So, where do you go for information? Well, you check out the channel here. Go to SSA.gov, Medicare.gov, one of those sources. Okay. All right. So, if you have health insurance through work or your spouse's work, you can just not get Part A or Part B. If you're currently receiving Social Security benefits, they will send you your card automatically. And all you have to do is, kind of return the card. No, no thanks, but no thanks. Wait until you no longer have health insurance from work. So that could be, 66, 67, 68. And then once you stop working, stop receiving health insurance from work, then you have to go ahead and sign up for Part A and or Part B. And you will not be penalized if you do the right thing. How do you do the right thing? Well, you have to, this is a bureaucracy we're talking about. You need a form. You need to fill out a particular form. So I am going to throw the form up there on the screen. And it is got two forms, the CMS 40B and the CMS L564. Okay, you got two forms here, and here's I just want to sign up. This is one for A and one for B. No, these are both for B. A is, again, it's free. They're not going to penalize you. 10% penalty on free is on zero, still zero. So when you go ahead and sign up for A and or B or both, at 67 years old, you have to provide these two forms. The CMS L564, you have to take to your employer. And here's one trick that a lot of people don't realize. You have to account for all the time since you turned 65 years old. So if now you're 70 years old, for instance, and you work for two employers and you had health insurance through both, then you need two of these forms, the L564. So you need two of those, one from each employer, because Social Security Administration needs to account for all of the time since you turned 65 to avoid that penalty. If you only provide one form for the last 2 years, then you're going to get a penalty for 3 years if you're 7 years old. So make sure you account for all the time since you turned 65 years old. Okay. And the other form, very, very easy, the CMS 40B. I will put both of those forms in the description below, and just go ahead and click them, download them, print them, and let's go through them. The 40B is actually to enroll. So the 564 is to avoid the penalty, 10% for every 12 months. So if you wait 5 years, guess what? 50% penalty. Not for 1 month, not for a year, not for 2 years, for as long as you live. You will have to pay, if you wait 5 years, you have to pay a 50% penalty of the premium. 50% of the premium, you'll have to pay that extra for the rest of your life. So it's important you don't do the wrong thing here. So the 40B, you just go ahead and fill that out. Easy. Your Medicare number. Do you wish to sign up for Medicare Part B? Yes. Your name, mailing address, city, phone number. Very, very easy signature. The next block on pretty much all documents the Social Security Administration produces has this bottom thing, and we get asked all the time, if the application has been signed by an X, do you need a witness? And people used to, get a witness to sign. No. All A vast majority of Social Security documents are like this. If for people that can't write, read or write, they just put an X there because they can't write their name. So if someone puts an X there, someone else has to witness. So the bottom part where it's, if you sign by an X, then you need a witness. We receive documents with the witness all the time, but I've never seen one with an X. But yeah, people just don't understand that part, and the form doesn't make it easy to understand. So in the 40B, the most important part is probably at the remarks, even though it doesn't have it. Some versions do, some don't, but most of the ones you get on the internet and directly from Medicare.gov and all the rest of it don't. In the remarks section, right down there, please start my Part B whatever month you wanted to start. So if you wanted to start, in October 2023, October 2024, make sure you write down there, please start my Part B this month, this year. And that way, when you send it to Social Security Administration, they'll know exactly, when you want it to start. The L564, same type of thing. Fill it out, your employer's name, the address. All right, here's the tricky part. The applicant's name and the employee's name. So if you're a spouse and this is your spouse's, your partner's work, that's the employee. So let's say she is the employee. She works, and you, the husband, are receiving health insurance from her work. So she's the employee. So you put down her name, the employee's name, and her social security number, and your name, the husband who is receiving health insurance from her. And so you are the applicant. You're the one applying for Part B. Okay. And if she also is going to start her Part B as well, then she has to do the same exact form, but she will be the applicant and she will be the employee. The next section has to be completed by the employer. You take it to HR and they fill it out, and it says, when did the coverage begin? Has it ended? If it hasn't ended, when will it end? When did the employee work for your company? And be very, very careful. And sometimes HRs mess up and they put the wrong end dates and start dates, and then Social Security says, okay, we're going to charge you 10% because you didn't have it there. And oh no, the HR didn't fill it out right. So you have to take it back and get it all over again. The bottom part for hours bank arrangement only. I don't think I've ever seen in a few decades working in Social Security Administration that part ever filled out. So don't necessarily have to worry about that part. How do you get these documents to the Social Security Administration? Well, you can mail them to your local district office, put them in an envelope, SSA, local office, any town, USA, and put on the bottom left SEP. That's a special enrollment period. And that way it'll go to the correct section in your Social Security office. So the bottom left of the envelope on the outside, SEP. And always make a copy of the documents, and that way, if it gets lost somewhere, you've got a backup copy where you can just send it again. So you don't have to go back to HR and get it all over again. And then you can also fax it. Yes, faxes. But when you fax it, do one of those confirmation receipts fax machines. So you just fax both forms to your local Social Security office, and it goes into a paperless system. And if you're a frequent viewer of my channel, you will know I was one of the people on the national team that designed the paperless system internally. So if you fax it, it will go there and they will process it from there. You can also take it down to the local Social Security Administration and hand it to them. If you need your Part B to start immediately, if not sooner, within the next, several days, weeks, because you need to buy a Medicare Advantage plan or a Medicare supplement plan, you need to be covered with something because your employer health insurance is stopping, then I would recommend to take it down to the Social Security Administration, hand it to the person at the window and say, hey, I need this done within like a week. Can you go ahead and just process it now? It's a very relatively simple input. They can just go ahead and process it. Because what happens if you mail it, they put it into the paperless system, they fax it, they put it into the paperless system. Again, it's an awesome system. I know the guy that designed it, helped design it. But it's only as good as the people that work it. And unfortunately, a lot of offices are backed up. And I've got many cases that are currently pending with clients that are looking for, to sign up for a Medigap plan or Medicare supplement plan or Medicare Advantage plan. And they haven't got their Part B yet because they mailed it and it got to the Social Security office in a couple of days, no problem, but it's just sitting there because of the backlog. So if you've got a month or two to wait, no problem, just go and mail it, fax it. But if you need it started immediately, if not sooner, then please go down to the local Social Security office, wait in line, and have them input it right then and right there and get it done. And that way, you'll get your card in time. Even if you don't have your card, like for instance, if you call us and you said, "Hey, I just applied for it last week," they said it'd take a couple of weeks. If you call me, I can check in the system and I can check to see if sent yet, and I can get your Medicare number quicker than you can get it in the mail. So if you're in a need to get health coverage, just go ahead and give me a call, and I can help you out. All right, that's pretty much the short and sweet of signing up for Part B or Part A during your special enrollment period. Again, once you stop working, you have 8 months to sign up for Part B to avoid the penalty. So once you get all signed up, then you need to figure out what you're going to do in terms of coverage for all the gaps. Original Medicare Part A and Part B are awesome, cover a lot, but there's a lot that they don't cover. Part A, for instance, there's a $1,600 deductible when you go to the hospital. Part A is hospital. There's a $1,600 deductible, and that could be multiple times a year if you're put in the hospital. The big one is the Part B coinsurance. So Part B, if you have surgery or doctor visits or some type of test or something, Medicare will cover 80%, but you are on the hook for the other 20%. You will be sent a bill and you've got to cough up that 20%. That's why almost everybody, unless you're independently wealthy, they get some type of insurance, some type of plan to kind of wrap around or replace in case of the Medicare Advantage plans. So there are two options: the Medicare Supplement Plan, also called the Medigap, or Medicare Advantage Plan. And I've got several videos on that. If you do the Medicare Supplement Plan, you also need a prescription drug plan. A lot or most of the Medicare Advantage plans come wrapped up with a prescription drug plan and also some dental and vision and hearing. Please make sure you watch my videos on that and become well informed. Or you can just give me a call, or better yet, schedule an appointment in the description below, and we'll check out all your options, tell you what's available in your particular area. And because I've spent a few decades in the internal beast that is Social Security, I'll also make sure Social Security treated you right. Make sure you're getting everything you're entitled to in terms of retirement, survivor benefits, spouse benefits, and all the rest of it while we look for a Medicare plan for you. So a full service A to Z service that pretty much nobody else in the country can provide because they just don't have the expertise and insider knowledge that our service does. So please give me a call. And of course, all our help is free. We never charge anything. So we'll talk to you soon and have a beautiful day.